On this World AIDS Day, health departments around the country are raising awareness about HIV treatment and prevention, including so-called PrEP medications. According to HIV.Gov, approximately 1.2 million people in the U.S. are living with HIV. But the CDC says PrEP drugs can now reduce the risk of infection by 99% when taken daily. Damon Jacobs was one of the first people to speak publicly about using these medications to protect himself from potential infection. Now he's sharing his story with ABC News Live as part of our new special, Viral, A World Without AIDS. Take a look.
Taking PrEP every day to prevent HIV for 11 years has been an act of self-love. It is a power that I did not have for the first 20+ years of my sexual life, when so much of my experience day to day was determined by losing people to HIV and AIDS, as well as the fear of getting it myself. The first time I started taking PrEP was the first time that I said, I now have full control over what happens to my body. I have full control over whether I get HIV or not, which is not something I ever had. So I started using this on July 19th, 2011, and have been taking it daily ever since. And there we go. It's as easy as that. Now I'm protected from HIV today, no matter what happens.
You're good for the day.
I'm good for the day.
And Damon, now an HIV prevention specialist, joins me live with more on this. Damon, I want to take a step back because you were in your early 20s living in San Francisco at the time of the AIDS epidemic. What was that like?
That was a time when AIDS was ravishing our community and when knowing people with AIDS meant losing people to AIDS. And I lost roommates, lovers, friends, colleagues, clients, just people you see on the street one day and then you don't see the next. That was such a regular part of living in San Francisco throughout the 1990s.
So when you look at where we were then and where we are now, one, how important is detecting HIV early? And what misconceptions do you think people have about the virus today?
Well, the miracle of where we're at today is that living with HIV is no longer a death sentence. That the earlier we can detect HIV, the earlier we can treat HIV. And that when someone's on medications for HIV, they cannot transmit HIV to another person. When they're undetectable, they're untransmittable, and their lives are saved. Their life expectancy is no longer less than someone without HIV when they get treated early. That is the miracle of where we're at. I think the misunderstanding and misperception is that HIV is still a death sentence, that it still results automatically in dying early or having a significantly less quality of life. And that is no longer the case.
Now, you talk a lot about PrEP meds as the way that you protect yourself. We just saw you demonstrate. I know that you said you haven't taken your pill today, so I know you want to demonstrate for us. What surprised you when you started with this daily habit and when you learned yourself about PrEP drugs?
When I learned about PrEP in 2010, I wasn't initially sure if that was going to be the right course for me, but I really thought about it and I learned about it. 99% from taking a pill, I could protect my body by 99% or greater by taking a pill every day. I'm like, yeah, I think this is right for me. So I started using this on July 19th, 2011, and have been using it daily ever since. May I show you?
Please.
Okay. Ta-da! I'm protected from HIV today. Yay!
Now,
So that, to me, just makes the most sense in terms of preventing HIV at this stage.
And it seems like it's super easy for you, but we know that PrEP drugs also come in an injectable form. Those sometimes are more effective for treating larger areas, children, for example, who are exposed and so on, because you don't have to take a daily pill. Well, but these drugs aren't always so accessible to everyone. Just the other day, yesterday, Doctors Without Borders put out an alert asking a pharmaceutical company to make these drugs more affordable, more accessible so they can help. So what do you think more needs to be done on that front to help prevent HIV around the world?
I think, yes, we do need affordable drugs. Now, this is generic. So the drug that I used to take, which was on brand, is now generic. So it's only about $30 a bottle, and that price is coming down. We do need affordable prices for the injections and for the other pills that are available. We do have a toolkit of options for PrEP. But I think what really needs to change is a shift in our thinking about sexual health and HIV prevention. There's still a stigma. There's still a shaming around those of us that choose to have active, healthy sex lives without condoms. And as long as there's a shame and there's a stigma attached to it, people are going to be less likely to want to use PrEP to prevent HIV.
And of course, anyone who takes a drug should talk to their doctor first before starting on that. And there are side effects that could come with PrEP, just like with any medication.
You want to know the side effects I've had? the best sex of my life for the last 11 years. But true, we do always want to be aware of the potential side effects, which is why I see my doctor at least once a year to make sure my kidneys are working, my cholesterol's fine. That's actually a smart thing to do in my life anyway. That's a smart thing for everybody to do. But because of PrEP, I'm making sure I'm getting regular screenings with my provider.
Well, Damon, thank you. One of many options that people should look into and explore to protect themselves against
I sure hope
HIV.
they do. So to be proactive, responsible, and empowered about their pleasure, this is the best way to do it.
Damon, thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.